Not now. The time is now 6:05. Okay. Good evening. This evening we have Dr. Mygleetus, Wright, that will be empowering parents on health education. I am Dr. Paula McGee. I have Oena Odoms as the hostess. The Fort Valley chapter of Links Incorporated, National Trends and Service and Health to Human. We will be using this forum to educate parents on how to support their children's health through increased knowledge about childhood illness that occur during the season, changes, and how to respond to symptoms when they appear. The more parents know, the better equipped they are to prevent spreading illness. So today, I will introduce, and without further ado, Dr. Mygleetus Wright will be the next voice that you hear.
Thank you, Dr. Paula McGee, and thank you, Oena, for this opportunity to speak on a very important subject. I am so grateful to be here to talk about something that is so profound, and that is how can parents keep their children healthy? As parents, you have the authority and the right to protect your children. And you know your children better than anyone else. You know when they feel sick, you know when they feel well. So this session will talk about some of the tips that you can do as parents to keep your children healthy, particularly during this pandemic time. Next slide, please. We'll look at some of the major considerations, some of the diseases that are prevalent and that are on the rise now, RSV and COVID, and then tips on what can parents do to keep their children healthy. Next slide, please. Now, many children will have underlying chronic illnesses. And the reason why I state this is that taking care of your children with chronic illnesses is very important to foster good immune function and to make sure that they are healthy. Asthma is a very common childhood disorder. And before COVID-19, asthma was responsible for more school absentee days than any other disease. Asthma affects about 6.1 million children less than 18 years of age. And asthma is a chronic disease, usually is diagnosed before 5 years of age. Now, many children will outgrow the triggers that may present with asthma. Triggers could be colds, the flu, changes in the weather, smoking. These are just some of the factors. Another underlying chronic illness is diabetes. And diabetes, particularly type 2, is being more prevalent in children now. In fact, 210,000 children less than 20 years of age are diagnosed with diabetes. And another chronic illness that can lead to other diseases is obesity. And 1 in 3 children are overweight or obese. And when we think about overweight or obesity, we are looking at the body mass index, which is a measure of your height and your weight. And if you are over 95 percentile for your age, for your body mass index, then you are considered overweight. A normal body mass index is between 18 to 25. Between 25 to 29, you're considered overweight, and 30 or above, obese. Next slide, please. So 17% of adolescents, those considered between the ages of 12 and 19, are at the 95th percentile for their body mass index. They're obese or overweight. And there is an increased risk of obesity in the following populations: African Americans, Hispanics, and Native Americans. So it's very important as parents that what can we do to help our children? Next slide, please. Well, complications of obesity include type 2 diabetes, because 50% of all new diabetics have type 2 diabetes. Type 2 diabetes is the diabetes that is not insulin dependent, but can be controlled with diet and exercise. Also, high blood pressure. We're seeing that more frequently in children. Orthopedic problems such as back problems, and elevated lipids. And elevated lipids, obese adolescents and obese children will become obese adults. And if they have elevated lipids like cholesterol and triglyceride, that can cause coronary artery disease, which can lead to heart disease. Now, some of the diseases that are prevalent in children, particularly during this time of the year, one that's very common is called respiratory syncytial virus, or RSV. Now, RSV, most children, by the time they're 2 years of age, will have RSV. It's a mild illness, usually with a stuffy nose, sore throat, cough, fever, and the child is not eating well. It's highly contagious in infants and children up to 5 years of age. Now, every year in the United States, about 58,000 children are hospitalized with RSV, and about 100 to 500 of them may die. And in the adults over 65 years of age, about 177,000 are hospitalized with RSV pneumonia. And about 14,000 of those adults will succumb or die because of RSV pneumonia. Pneumonia is still in the top 10 list of diagnoses for causes of death in the United States. So why is this important? Because if your child has symptoms of cough, stuffy nose, fever, and signs of wheezing and not eating very well, signs of dehydration, decreased urine output, then that may mean they need to be hospitalized. Normally, there's no treatment for RSV. It usually goes away with supportive care, good fluids. But if your child, we normally hospitalize children if they're not able to eat well, so they need to have an IV placed in their arms, or they need oxygen. Next slide, please.
Dr. Wright, can we pause really quickly right now so I can adjust some things with the stream?
Certainly. RSV or flu, if they have these symptoms of cough, as particularly shortness of breath and fever, and to take them as soon as possible. Next slide, please. So what can you as parents do to keep your children healthy? So there are some things that you can do. First of all, you want to keep your children current on all vaccines. Now, we know that children start their vaccines at 2, 4, 6, 9 months, 12 months, 15 months to 18 months, and they're going to be getting the diphtheria, tetanus, pertussis, the Haemophilus influenza B, that's the H influenza B vaccine. And let me say that when this vaccine was licensed in 1988, I haven't seen a case of H influenza B meningitis since that time. Before that, when children would develop meningitis, we could treat that because we had the antibiotics, but children would be left sometimes with hearing deficits and with cognitive school learning problems. So that has been a very benefit of that vaccine. They also recommend the inactivated polio vaccine during the 2, 4, 6 months and 1 year booster dose at 4 years of age. You get the measles, mumps, and rubella, and the varicella or the chicken pox at 1 year of age with a booster at 4 to 6 years of age. The hepatitis A, you start at 1 year of age with a booster 6 months later. 11 to 12 years old, they recommend the HPV vaccine and the meningitis, the Menatra. with a follow-up dosage 6 months later, the second dose at 16 years of age. And also at 16 years of age, they're recommending the Menatra B, meningitis type B, because you see a lot of that on college campuses. So it's very important for children to get their routine vaccinations. And we don't see diphtheria, we don't see tetanus in the country as you might see in developing nations because of the vaccinations. Now, I had a parent once to say, well, I don't want to get the DPT for my 2-month-old. I just really don't want to get the vaccinations. I said, well, let me just let you know that whooping cough, which is pertussis, is very, very serious in children less than 1 year of age. As a matter of fact, 50% of them, if they contract whooping cough, may die. And we still see the parapertussis, which is the bacteria that can cause pertussis in children and adults. But because they're so young, less than 1 year of age, their immune system really can't handle that. So it's a very severe disease. So the parents say, oh, I didn't know that. So I will decide to get the vaccine. So as parents, you have the right to make choices for your children, but it's very important for healthcare providers to make sure that you make a well-informed decision, that we let you know what may be the consequences and what the studies have shown, so that when you're making that decision for your child, you are well-informed of the information. And so also now to add to the vaccine, COVID-19, the Pfizer has now approved the vaccine for children 12 years or older. And they are coming out with a vaccine. They've done studies to show that those 5 to 11-year-olds may receive the vaccine later on, will be approved later on this fall. And of course, the annual flu vaccine is recommended anytime from 6 months on upwards, the flu vaccine. Now, it's important for parents to stress proper hand washing. Make sure your children are washing their hands 20 seconds. They can sing the happy birthday song, and that's about 20 seconds. Washing their hands before eating, when they come in from playing, just really good hygiene. Proper hand washing can really help decrease the spread of germs. And also during this time of the pandemic, watch for signs of stress. If the children are feeling anxious, they're irritable, they just seem a little bit upset, you can do things like have them to write things in a journal, maybe taking nice walks, doing board games, and if necessary, referring them to proper counseling. Because during this time, there's a lot of upheaval with children sometimes having to go to school, then switch to the online courses. So it's very important for parents to just make sure that you are looking for those signs of stress and trying to combat that. Next slide, please. So how can you help the immune system for your child? Well, first of all, it's important to have good sleep hygiene. Children need about 8 to 10 hours of sleep each night. Getting sleep helps to boost the immune system, helps to decrease the incidence of obesity, and also having a healthy diet is important. It's important to have 5 to 7 servings of vegetables each day, making sure they're not having saturated fats, not too many sugars in their diet. And it's important to have exercise. Now, so much that we've done is on the computer now, but it's still important for children to go outside to do some type of exercise, because exercise helps to boost the immune system also. And also 15 minutes a day in the sunlight can help vitamin D. Next slide, please. What can parents do? You can limit the amount of times the week the family eats fast food. Make changes in the parental eating habits. It's important sometimes to increase the frequency of family meals. Studies have shown that when children sit down at the table and eat with their family, they're more likely to eat more healthy. They can also discuss things that may have happened during the day. It's a good time for communication. It's a good time to relax, a good time to find out about what's going on with your children. How are things at school? How are things with their friends? So increasing the frequency of family meals is good for the children and adults. And also something we need to do when we talk about obesity and eating habits is kind of change that coercive style for eating. You know, we've always said, clean your plate. Well, make sure that the child just needs to eat until they're full. They don't necessarily have to clean their plate. And so we need to not have that kind of coercive style because it can lead to overeating. And also we can limit portion styles. We'll say that the fist, that if you have a fist, the size of the food for a fist is a good portion size. Next slide, please. You can develop exercise patterns for the family, maybe taking walks, maybe doing some outside games, anything that you can do to help get up so that you're not sitting, that you're not staying in front of the computer or the iPad or the TV for extended periods of time, just something to keep those muscles moving and just to keep you active. You can ask the schools to decrease the soda and vending machines. Now, there are some schools that may have vending machines that will have water, and that's great. But many of the students will have vending machines in the schools that will have unhealthy snacks that are high in sodium, and also that will have soda and also sweetened beverages. And these excess sugars can lead to excess weight. So you can ask the schools to monitor the dietary programs. That's what you can do at the PTA meetings, at the school board. You can speak up for your children to say, let's promote a healthier eating style for children by not having vending machines that have unhealthy snacks. Next slide, please. What can the community do? They can increase the walkability in the community, more parks. You know, children love the parks. There's a new park in Centerville, Georgia, and children love that park. They can walk, they can play. It's good outside activity. And as I say, when they're getting the sunlight, they can get vitamin D processed, and that's very good. We know that vitamin D is good for helping to alleviate many chronic illnesses and helps to boost the immune system. They can increase the community's safety for walking in the community, well-lit streets, sidewalks. They can increase the availability of places to eat with healthy food choices. It's nice to see sometimes that some of the fast food places will have healthy food choices, salads. They also may have apple slices as part of the children's meal. So those are good things to have. And so encourage your children maybe to have the apple slices instead of the French fries, to have water instead of soda. And schools can eliminate the soda machines. And when we talk about beverages that are sweetened, it's better to have the fruit, the apple or the orange instead of the fruit juice. The fruit juices do not have that much vitamin C, and they have more sugar than vitamin C. So it's more important to have, if you want to have vitamin C, fresh fruit. Another thing parents will say, well, do I need to give my child supplemental vitamins? If your child is having a diet that is varied and a good diet, they will get all the vitamins and minerals that they need from the food. It's best to try to give healthy meals with good choices so that they can get the vitamins from their good, nutritious meals. Next slide, please. So the bottom line, when we talk about, is that parental involvement has a huge impact on the health status of a child. You as the parent, you have those rights to protect your children. But what you need to do is to do the best that you can to provide a healthy, safe environment. And in this climate now, make sure your children get their immunizations. Make sure that if you see symptoms, particular of cough and congestion, that they're taken to get the appropriate test. Make sure they're exercising properly. Make sure they're sleeping properly. And thank you so much, and I welcome any questions.
Dr. Wright, I do have a question, and this is Oena.
Yes.
A number of the things that you did say just a moment ago, well, many things that you did say, I wanted to ask regarding, well, COVID again.
Okay.
You brought in some very useful information in, well, it seemed like in support of how to keep children safe, but then also considering, if they're in the age group, the vaccine. What other things might you say, or might you suggest that we say to help parents to really weigh out the options and better make an informed decision as to whether or not to do the vaccine for themselves or for their children?
Well, I think you have to just look at the data. The scientific data has shown that wearing masks decrease the transmissions of viruses that are transmitted through the aerosol. We saw last year a decrease in RSV and flu simply because people were wearing the mask. Now that they have stopped wearing the mask, we're seeing an uptick in the RSV and the COVID. So that we're seeing that. So we know that wearing a mask is very important. And we've seen evidence that shows the vaccine. 95% of the patients that are hospitalized now are those that are not unvaccinated with the COVID-19 vaccine. So just looking at that data can tell you the benefits of the vaccine. And we also see that people who have obtained COVID may have long-term problems with their lungs, with their heart, with their kidneys. So it not only affects the respiratory system, but may affect other organ systems as well. So I would think just looking at the scientific data will help parents to make that informed decision that it's important if the child is of age at this point, 12 years or older, and as well as adults, 12 years or older, they can get the Pfizer vaccine. As adults, 18 or older, you can get the Johnson & Johnson or the Moderna vaccine. But it's important for them to look at that to keep their children healthy. Because what we're seeing now is that we have children who are going to school, who are being exposed to others who may have the COVID-19. So they're having to go back home, go back and forth. And that can be very stressful, where you're in school one week, then you're out the next week, and just going back and forth with that. It's really hurting the children because many of them are not able to keep up or with the online courses and what they need to do. So it's really important for parents to look at that data and to make that decision. You know, you can tell your child, wear your mask, social distance, wash your hands, have those antibacterial wipes so they can wipe down their desk and just disinfect. Children they are usually very resilient. And if they see their parents taking an interest in doing that, they want to do that. And many children will look at the science and say, you know, I want to get the vaccine because I want to stay healthy. But the parents are the ones, particularly those that are less than 18, that will have to make that decision. So I say to parents, look at the data, look at what we've seen when we do wear a mask, and look at how the benefits of the vaccine outweighing the risk. Particularly, you don't want your child to contract COVID.
Dr. Wright, I have a question for you.
Yes, ma'am.
Some of the concerns in childcare centers today is that we often have children that come to the center and they have a discharge from their nose. Sometimes it's clear, then it starts getting cloudy, and then it changes colors. When should the center or the parents get concerned that it's time for them to go to the doctor?
Okay, that is an excellent question. Children, normal children with an immune system, they may have 6 to 8 colds per year, where they may have the clear that may turn a little cloudy, and they normally will do very well and get over that. When the child has fever, anytime a child has fever, they're contagious. So if the child has fever, they really do not need to go to the daycare. They need to stay home. And if their symptoms are not improving, they need to be taken to the healthcare provider, particularly if they're having any type of struggling breathing, where they may be using their accessory muscles, like you see me doing this, where I'm breathing. That is a sign they're having difficulty, to the emergency room. Or if they are not eating really well, and you notice that if they're a baby, they're not making tears when they cry, or their urine output, that is a symptom. They need to go to the healthcare provider. So if they're playful, if they are eating well, if they have no fever, if they don't have a cough that is of concern, they just may have the regular cold. And sometimes it may get a little bit purulent, and sometimes it may not. Now, if they start having a fever, you may worry, do they have a sinus infection? So certainly a fever would be an indication that they do not need to go to the daycare center.
So when you say a sinus infection, so therefore the mucus is now kind of a greenish color, that indicate that they have a sinus infection or
It
it's
could
been
be.
infected?
It could be. Sometimes you could still have with a cold, you still might have that, but particularly if they have a fever, if they seem to have their soreness around, if you press around their cheeks and they seem to have tenderness there, or if their breath is really, really bad, that may be an indication of a sinus infection. Say, even if they don't have a fever, that they may need to be checked to make sure. So that's something you may want to look at. But just because it may be just a little tinge, if they're doing well, they're not having any problems, it could still be a cold. But I think if it's progressive, if it doesn't clear up, then they need to be seen. Now, children can have a clear nose and congestion from allergies. Many children will have allergies. And so sometimes if they continue to have that congestion, they still may need to see their provider because they may need to be tested to see if they are allergic to something. And that's why they're always having congestion. So sometimes I don't look so much at the color of the mucus, but what other symptoms are going along. So if they have that little yellowish, greenish discharge, they have a foul odor from their mouth or their breath, they have some tenderness around their eyes or so, that may be a sinus infection. They need to be seen.
Okay. And I'm glad you said about allergies, because oftentimes we hear parents saying all the things that you just described as being allergy. Well, as you know, Georgia is one of 7 states that had a high number of children with RSV here lately. And some of our centers, we've had a share of it as well, of children getting reinfected with RSV. What can we do to help prevent that, keep that out the center and to help educate parents on that as well?
Well, if the children are able to wear a mask, and that's normally 2 or older, you would want them to do that because we're in the middle of a pandemic now. And really everyone should be masking up because we still have that Delta variant of the virus still is predominant and still easily contagious. But you don't wear a mask if they can't wear a mask if they're less than 2. So what you can do and what parents need to do is just really, if the child has a fever, they shouldn't bring them to the daycare because they are contagious. And that's how you would know if there's something more than just a common cold. And because parents, if they're bringing the child to the daycare, they're not monitoring them and they have a fever, that's why people get reinfected. So I think it's important during this pandemic, the staff should probably wear masks and children, if they're old enough, should wear a mask. But see, people don't want to wear masks. And that's why we keep getting reinfection because we're in a pandemic and they're not wearing a mask and things are just easily transmissible. So how do you know if it's RSV versus COVID? Well, you don't know early on. So that's why children that may have a cough, that may have a runny nose, that may have a fever, may need to go and get tested, particularly during this time, during this pandemic time. And you would need to know, therefore, if they have RSV, you take them away from the daycare. But if you don't get tested, then you won't know. And that's why it spreads and they're contagious and you may get reinfection.
Okay. Thank you, Dr. Wright. We have so many things that occur in the daycare and parents don't really know. For instance, with little small babies, infants that have difficult breathing, and you can hear the wheezing and the baby airway seem like it's constricted, and the parent doesn't have any medication, haven't brought anything, doesn't have a nebulizer, anything for the baby. For a daycare provider, we're looking at liability,
Yes.
life and death with that baby. So
Yes.
our first thing in mind is that child cannot stay here without going to the doctor. What advice would you give to us as a daycare provider?
I think you are exactly correct. That is a liability anytime there's difficulty breathing. So if you have difficulty breathing, that child should not stay there because sometimes it can be between respiratory distress and respiratory arrest can be very quickly in a child. And so it's very important. If they're having difficulty breathing, that child needs to be seen. Their lungs need to be examined. They may need a chest x-ray. They may need a nebulizer or a breathing treatment. Something needs to be done because, as I say, they may be, when they're having difficulty breathing, it's respiratory distress, but you don't want to go when they stop breathing where it's respiratory arrest. So it's important to intervene as soon as possible. So I think as a daycare provider, the liability, if there's a child that has difficulty breathing, they need to not be in the center. They need to be seen by a healthcare provider as soon as possible. Now, some children, if they have asthma, which is a chronic illness, many parents will already have the diagnosis. They'll have the medication. They'll have the breathing treatments. They'll know, they may then let you know, and they may have the resources there, and they may bring their machine and their medication if they're to be given treatments every so often. But still, if that child is having such an exacerbation of their asthma that they need treatments every 4 to 6 hours, they need to not be in the daycare at that time either. So it's important to make sure you err on the side of caution, and you're not really erring at all when you're having a child to be seen who has shortness of breath. So yes, any child that has shortness of breath or difficulty breathing does not need to be in the daycare. They need to be first assessed to see what's the cause of the problem so they can be properly treated.
All right, thank you. And with allergies, oftentimes they say, my child have allergies. I have an EpiPen. They bring one EpiPen to the center for you without a plan of action. And we, on the daycare provider side, we say, well, we cannot accept that EpiPen. You need a written plan from your physician indicating what should be done. Because do they just get one EpiPen? How many EpiPens should they be bringing to the center? And what is the treatment plan? And do you all, I know I'm asking so many questions at one time, do you provide them with a written, I want to say a prescription, a written plan of action to give to their provider so that they can help that child if something should happen?
Well, they should have a written plan, because if a child has, that's an excellent question. If a child has a severe enough allergy that they need an EpiPen, that means they have an allergy where they can get shortness of breath very quick if they're exposed to something. So that the EpiPen has epinephrine, which is a life-saving medication. And you normally will only give 1 dose of the EpiPen. And then you need to immediately call the ambulance, because they may need to, by the time the ambulance gets there, they can assess if there's any oxygen or anything else that's needed. So most of the time, the child will have the EpiPen, and they'll have the prescription. It goes from 0.1 to 0.3 milliliters, and they'll have that written. They should have it on the prescription, on the EpiPen, of how much to give. If that child should have that, then immediately the 911 is called so they can assess the child. But you only need to give 1 EpiPen at that time. And usually that will help. And by the time the ambulance gets there, they can further assess the child for if they need fluids, if they need oxygen, or a further medication. But the parent needs to have a plan of action. And usually when the provider prescribes the EpiPen, they will give them what the plan of action is and why they should have it. Some people will have an EpiPen because they have an allergy to bee stings, and they may not know they may be exposed to bees, you're not sure, or to ants, if they have a severe allergy. So somebody who has an EpiPen, they usually have allergies. In particular, if they have food allergies, they could inadvertently be exposed to a food that may cause the swelling of the airway. And so what that epinephrine is a neurotransmitter that can easily relax the smooth muscles of the airway to help you to breathe. And so usually 1 dose is all that's needed.
Okay. Thank you, Dr. Wright.
You're welcome.
There are instances where children have a rash that looks so close to eczema, and it could be a ringworm. The first thing they say, my child have eczema. What is the difference?
Now, the difference is that usually with eczema, you will have the skin will be very, you'll have raising of the skin, and it will be the entire area. Usually with ringworm, you'll have a little ring and there's central clearing. So you'll see that the entire patch of skin is not raised or rough. there's a ring around and the area is clear when you have ringworm. So that may be the difference. But you can take your child to the physician. They have what's called a Woods lamp. They can do various tests and scrapings to see if it's eczema versus ringworm. But ringworm, usually there's central clearing. That entire area is not rough as you may have with eczema. Eczema usually sometimes will be on the antecubital area of the arms. It will be on the cheeks. It may be on the knees, behind the knees. You'll see in certain areas that you will see eczema, maybe on the stomach. We have something that's sometimes called a nickel dermatitis or eczema, where we may see babies that will have those snaps that are made out of nickel, and you'll see where the snaps are located, there's a rash. And so the rash will clear up if you put maybe some hydrocortisone on that or medication, but then they notice it comes back. And so we'll look and say, what do the baby's snaps look like when they have their onesies, or if they have anything that will, a piece that will have nickel on it, and we know that's a nickel dermatitis. And so they will no longer have those clothing that will have nickel in it, those fasteners there, and that will help to alleviate that. Because if you don't, and you still wear those clothing that will have the snaps made out of nickel, the rash will still reappear. So the difference, eczema, you have the rash is rough all the way around that patch. Ringworm, you have a rash that's in a ring, but there's central clearing. You don't see the rash. There's some clearing in that is a distinction.
Okay. And even with that eczema, sometimes children come and they have a ring that looks like a sore, and there's pus oozing out of it, and they say that's eczema as well.
No, that's more like impetigo. So that's something that anytime you have, and see, eczema can become secondarily infected. So anytime you have pus that's oozing out, that's a very good point. That needs to be treated, because that may be secondarily infected with strep or staph. So anytime there's pus that's oozing out of that it could have started off as eczema, but it's gotten secondarily infected, and that needs to be treated with an antibiotic.
All right, thank you. And there's other times when children come and they have eyes that have, what I want to say,
discharge from the eye?
Discharge from the eye, yes. And it's all caked up with it all around the eyes when they wake up from their nap time. And parents advise they might want to take it to the doctor to see what's happening. Well, the parents say, oh, there's nothing. We just take a cool cloth and we wipe it off and it's fine. But you see that child through the day favoring that eye because they continue to rub that eye as if something is happening. Is that a sign of the onset of pink eye?
It is, and pink eye or conjunctivitis. And that's something that's very contagious. And when they see that, you know, whenever you see like you said, now this is where when you may see a discharge that's like a yellowish tinge that you see that's pink eye. That needs to be taken care of and needs to be seen by the healthcare provider to get drops and medications for that. So, and that's very contagious. And that's why some of these, what you're bringing up is very important, because some of these can be very contagious. And that's why it's important that the parents do take the child to the healthcare provider to get the appropriate treatment so that it will not spread to other children. And that's why it's so important. And you bring up very good points. You know, as the daycare provider, if you see this, you let the parents know this is something that needs to be seen, because it can spread to other children. Because children, you know, they put their hands everywhere. They touch things and they put their hands, unlike adults. You know, we usually wash our hands. We're not touching our mouth, our eyes all the time. Children do this. That's why things are so contagious so quickly with them. So that's why it's important when you do have pink eye, when you do have the discharge from the eye, that is taken care of, and they look at it and examine it and make sure they get the appropriate medication.
Thank you. Because oftentimes some parents feel as if I put a patch over that eye, that child is fine and will not pull it off. But you and I both know small children is going to do what? Take their hands and pull it off. And contaminate someone else.
That's exactly right.
I have another question that someone just sent to me to ask you. Do ringworms come in patches?
They can. I've seen quite a few ringworm that's in the scalp that can be in patches. So you can have yes, you certainly can. You can have a different patches of ringworms, and you can have it on the skin in different places. So the answer is yes.
Okay. This is going to go back to allergies, because oftentimes children have milk allergies. And sometimes we have parents that are a little reluctant to go and get the form that they need so that we can put it in our file for a USDA. And they say, oh, it's fine, they can have the other milk. Can they have the other milk if they're allergic to that milk?
Well, if they have a milk allergy, sometimes we'll look at if they're allergic to cow's milk, and you have to look at the allergy panel where they look at that. And if they are, then they may be able to take rice milk or almond milk as a substitute if they're allergic to cow milk. So it's important just to know exactly what they are allergic to. So what they need to do is when they say they're allergic, they need to have a note from their provider to say exactly what they are allergic to. Because now see, if they are allergic to nuts, they can't have almond milk. They might have to have rice milk. So it's important to know exactly what they're allergic to know what type of substitute or what type of milk they could have.
Okay. We have had children that have asthma, and we've been told by the parent, well, when they run and get hot, just let them sit down. They'll be all right. Should we be alarmed being the provider?
Well, I think it depends on the child and looking at the symptoms, because one of the triggers for asthma is exercise. It could be exercise-induced asthma. And so if a child, many times if they have been diagnosed with exercise-induced asthma, their plan of action is for them to take their inhaler 2 puffs before they start the exercise. So that will help them during the exercise not to have an attack. But if the parent notices that, and it all depends on the child, if they are, just to see how they're doing, if they're having difficulty breathing, they have their inhaler with them, then they need to take that and then call 911 or their parents to come and get them, because it depends. We don't know if they're going to get better or if it may get worse. But sometimes parents will say that because they know that if their children exert themselves, that can trigger coughing. Sometimes it starts off as coughing, not necessarily breathing fast, but coughing. And that could be the first symptom. And that's when they need to take their inhaler, their rescue inhaler, which is that which gets in immediately. Children who have asthma, chronic asthma, may have their sustained medications that they should take at home before school and after school in the evening. But what they should have at school is their rescue inhaler, because that's what's going to give them immediate relief and open up those smooth airways so that they can breathe easier. So that's maybe why the parent is saying that. So I think as a provider, you look at the child, you see, are they having any difficulty breathing? Are they fine? Do they just need to rest? But what's important also, and you may want to let that parent know that if that child has exercise-induced asthma, they should have a plan where they take their inhaler before they start exercising, because that's what the plan is, to keep them from having an attack.
Okay. To add to that, no inhaler was produced. Parents have never said their child been diagnosed with asthma, but those are the signs, as you described, that they're exhibiting.
Then that child needs to have an evaluation. They need to have an evaluation. And so what you should do is, if the child is not in distress, but you notice they seem to get tired, sometimes warm fluids can help relax the airways. And if they're not here, and then that parent needs to be told the child needs to have an evaluation to see if they have not been diagnosed with asthma, because if they're having difficulty with their breathing, or they're having shortness of breath after they exercise, it may be undiagnosed exercise-induced asthma. So that child needs to be evaluated.
Okay, thank you. This back to the ringworms again. Ringworms, oftentimes parents will say, my child has been treated, for the ringworm, and I'm going to put a Band-Aid over it, and they will be fine to come back to school.
And that is acceptable, because if the child has been treated and if the area is covered, that should be fine. Now, as you know, sometimes children can it depends on the child. They take things off and expose others, then that may not be a problem. Or if they're sharing, a lot of times if there's ringworm of the scalp, it's because they've been sharing hair utensils or wearing the same cap. But if they've been treated and that area is covered, they should be fine.
Thank you. And these are small children, 2 years old and younger, that we're talking about. And parents are saying they put a Band-Aid on it and they'd be fine. And our concern is, as you indicated,
that they will take it off. Yes.
Well,
and it may not be fine if they take it off, because then they can spread it. But see, if it's covered and they don't take it off, then that's fine. But you run the risk, like you said, if they're small and they're uncovered, it could be possibly exposed to other children.
We have noticed that children have little small rashes that indicate they might have scabies. And scabies is something that one point in time was not so prevalent, and now it is coming back. What will you tell parents and providers how to look out for that?
Well, it's important. Now, sometimes scabies can be a little difficult to diagnose, because sometimes it can start off, usually it's a rash right around the midsection of the abdomen. And sometimes the provider has to actually scrape that skin and look under a microscope with that. So that can be, sometimes it's difficult to diagnose. It may take 1 or 2 visits, because sometimes you may not get a clear-cut history. But if that can something that's easily treated as well too. So I think it's important that, first of all, they get an accurate diagnosis, and then they get the proper treatment for scabies.
Dr. Wright, I thank you. You've been excellent. You've answered all the questions and concerns that we have had at centers for some of our parents. I want to say young parents, but all our parents, because some of the issues that we've just asked you tonight are things that's really happening inside of our centers. And these are answers that we really need to know, and parents really need to hear, to come from someone that's trained to do this, other than with me being a provider telling you cannot come back. So I thank you very much for doing this tonight. Thank you, Dr. Wright.
You are so welcome. And thank you for all the work that you do, and for all the daycare providers, because you have a very important job. And the parents really should be very thankful to have such caring providers to take care of their children. And so we all work together for the health of the child.
Thank you, Dr. Wright.
Thank you.
Yes,
So
thank you.
Go ahead.
I was just saying thank you. Go ahead, Dr. McGee.
I was going to say that this will conclude our forum tonight. Hopefully we have many more in the future. This meeting tonight will be televised on YouTube. You will be able to see the slides, and you will hear all the questions as many times as you would like to see it. And I invite you to do that. And once again, I'd like to thank you from the Fort Valley chapter of Links, and from the different facets that we have here. Dr. Wright, Health and Human Services, to you, as well as National Trends, Fort Valley State University, Health Advisory Council, and the Fort Valley State Early Head Start Program. And of course, the Learning Tree Center of Georgia Incorporated. Thank you for signing on. Thank you very much, and good night.
Good night.
Good night, everyone.